We've got a few people watching. We might get some more here as we go along. If you guys are watching right now on Facebook Live, please share. I think you're going to really enjoy hearing the story. I have so enjoyed getting to know Amy a little bit and just hearing about their ministry and their organization. So if you're joining us now, or you start joining us in a little bit, share. This is a great organization, really cool story. We just want to give an opportunity for more people to know about what they do and kind of what's going on. So I'm going to let Amy introduce herself in a second, but I want to just preempt with, here's why we wanted this conversation to happen. I first learned about OVI, gosh, it's been almost 2 years now, probably. We had just come on staff at Southeast, and we were at a fundraiser, and they were talking about the ministries that this organization supports. And one of them they talked about was your organization, and shared a video and kind of talked about this young couple that had gone to Kenya to help start an organization and build a hospital for orphans. And I was shocked. Like, I was like, that is an amazing idea. That is a very original idea, a very unique take. And so within a couple of days of being at that event, I asked the organizers, hey, can you introduce me? Like, I want to know who these folks are. Will you introduce us by email? And so we connected by email. And I've got to hear more of your story and just how OVI has grown, some things that you guys have done from starting from just, hey, we're going to be a hospital for orphans, to all kinds of things that I'm sure we're going to get into tonight. It is just incredible. I will tell you, when I first shared your work we have a small committee of folks at the church that help distribute some funds to organizations like yours. And when I shared your work with those three other guys, we all just kind of said, A, yes, we'll definitely be supporting, but B, we all feel like we haven't really done anything with our lives, because you guys have just, just gotten out there and done some really, really cool stuff. So
thank you so much.
Yeah. So will you tell us, Amy, just a little bit about yourself and about your family before kind of getting us in a little bit to the story of how kind of OVI maybe got started a little bit?
Yeah, absolutely. So I'm Amy Hehre. I grew up here in Kentucky, Somerset to be specific. I met my husband at church camp when I was 15, and we were friends for about 7 years before we decided to randomly get married. We have one daughter named Lilo, who we've officially adopted and adore. We have a foster son named Moses, who lived with us for 2 years, had to go back into the system for about a year now, but we are hoping to have him back in our home very soon. And we live in the top story of our hospital, the first hospital that we started in Kenya, called OVI Children's Hospital. So my life is, that is my life. I had originally planned to be a clinician, but ended up doing, as our dream expanded, I do a lot of work on the computer, a lot of speaking engagements, and kind of what everybody else is doing right now, like having to work from home. And that's what I have to do a lot in Kenya too. So
yeah, for sure, just to manage it and keep up with it and share it. Yeah. So cool. So when, where did the kind of original idea and the original dream really come from, as you remember it, like to kind of go off and do this pretty brand new thing for you, for a young couple, you guys, just like newly married and kind of thinking about this thing, as I think if you talked about it, you had this dream even before you and Robert were married, to kind of step into this. And so, just where'd that come from for you?
Yeah, I literally drew it out of a hat. So I was at a conference and I was about to start my junior year of college the next day, but I drew out this question, and it was basically an icebreaker question, like a game to get to know people. And I hate those because I'm an introvert, but I pulled it out and they're like, if you could live any life, what would it be and why? And I always joked that I was a pageant girl at the time. So, I'm quick on answers and ready to go. And I was just like, well, if I could have theoretically any job in the world, I would love to go and find medically vulnerable children and help them get the healthcare that they need so that they can live, better lives. And they're like, wow, that's really cool. And we just kept going on in our conversation. And then it's like 1,000 people at this conference. And they're like, hey, did anyone learn anything cool about the people in their group during the activity? And the guy in my group stands up. He's like, yeah, there's this girl in my group who goes and does life-changing surgeries for children all over the world. And I was just like mortified. I was like, oh, I don't do that. Like the question was theoretics. Like if you could do anything, what would you do and why? And so here I am. I've just finished like my last core, whatever, what do you call them? Like the things you have to do before you actually get into your major. I took astronomy because I did not want to learn about the human body. But just immediately was convicted. People kept coming up to me, amazing what you do, amazing what you do. And I'd be like, no, it's just a confusion. And then one guy, I can't remember his face, anything about him. He's like, hey, if that's the life that you want to be living, then why aren't you living it? And it was like a bag of bricks just fell from the sky and I couldn't do anything else. I was just so heavy and convicted. And so I remember sitting there in the conference and changing my major the day before my junior year. I'm like, okay, whatever pre-med is, like, let's sign up for it. And yeah, it was very much all of a sudden thing.
Yeah.
Very bizarre.
I think, I mean, I was talking with somebody today actually. You know, I mean, I think from what you're talking about, like to me, like that's what calling is, right? It's the sense of like, I have no idea. Like, I don't even know what it fully means what it will look like every day and every way that it will play out. But like, I feel the sense that I should be doing something. Like, I don't know what it will look like is different and unique, but that's really cool. Really cool.
And I feel like a lot of times we think that God just naturally gifts us and we confuse our gifts with our callings. And for me, you know, I had dyslexia and I'd really struggled, but I had succeeded. I was a perfectionist. I had a 4.0. I was in the honors college. But when I switched my major, like it wasn't like I just drew it out of the hat and then the next day I had a fully funded hospital. Like the next semester, not only did I make my first B, I made my first F. Like I failed a course and I was like, God, like, why would you call me to something that I'm terrible at? Like, okay, let's get this straight. Like if I'm going to do this next semester, I don't care if it's a Las Vegas style and I have to close my eyes and circle the questions. Like you've got to pass this because I'm never going to get into a medical program if I can't figure out what I'm doing. And the next semester I failed a class again and I was depressed. Like I was so defeated and I was like, how could I really be called to this? But I still went to Kenya. I was like, I want to see it. I want to feel it. I want to know that this is actually not just in my head. And I went and saw the faces of the children, saw the need. And that was all I needed. And God just completely paved the way. I eventually started catching on to the sciences and fell in love with just, I call it emotional learning. I would go in and take care of patients in my clinical years and see them. And I remember the medications on the table when we were treating them because I remembered how I felt or how I connected with them and things about them. And so God had really gifted me with something unique. And so that's always my encouragement when people hear my story is, you know, it's not as easy as it sounds, like drawing it out of a hat and then God just gifts you and does it. Like that was the biggest sacrifice in the hardest time of my life. Like my hardest hardships really were getting through the medical program and, you know, pushing through that inadequacy and learning that just the bigger loser I was and the less qualified I looked, like the more glory that God was getting. So it wasn't about proving myself. It was just about showing up for being that broken vessel that God could use for his own glory. And that takes the pressure off. That's when you can really do anything that you're called to, when you just eliminate yourself from it.
Oh, that's so good. That's so good. Yeah, I think often we have just so much confidence in like, oh, if I do this thing, if I market it this way, if I like strategize, if I get this, you know, person in line, if I, you know, am in this role or in this position, then it'll all fall into place. And it's like, no, I still, even when I do my best work, have to trust that God is gonna be in control of it.
Yeah. And I always tell that story specifically, not because it's fun. It's actually very vulnerable, you know, to as a clinician, tell anyone that you felt anything in your life, you know, but I say that because I know so many students, so many people who have changed their entire life direction because they got a B or a C and they're so afraid they won't get into medical school. And I know that I got into PA school with applicants who had 5.0s, like literally had taken every AP class, everything their entire life, had applied for 5 years and they got in that year. I got in my first try. Like if God wants you to get in, I applied to one program my first time, 2 F's on the transcript, still got into the program. And only God can do that. Anyone who's in the medical world whatsoever knows, you know, I just hope that my story can really inspire people, like, no matter how little money, anything, like, it looks like God is closing doors, but you have to be really careful because Satan loves to try to throw up those false doors when really God's still paving the way for it.
Yeah, for sure. For sure. So you have this vision to go and do this thing, and you very clearly, like, Kenya is on your heart. So how does it go from the vision to, hey, we've got a building, we're turning it into a hospital? I think that, I mean, I love that part of the story, so that's why I asked you about it, but it's just so cool.
Yeah, absolutely. So Rob and I got married. It was like the dream for the thing. And then we kind of fell in love amidst that dream because he knew he was called to missions. He didn't know where. I had an entire plan for what I wanted to do for the world, and he liked it. And so we got engaged, went to Kenya once. And once we were married, we went again. And on that trip, we were going to, it's very crazy, but we were visiting an orphanage, and a very random last second trip, a motorcycle driver who we met when we were picking up some wood to finish a playground building project was like, you have to go to this orphanage. Like, I just feel like God is telling me you have to go to this orphanage. And I was like, oh, we're actually already scheduled to go to another orphanage tomorrow, but thank you so much. And he's like, no, I'll be at your house at 1 p.m. I already told your host mom. We're like, okay. And he actually showed up, which never happens in this culture. Like, people are very late, and we're like, okay, well, I guess we're going. And actually, I went there and I met my daughter. I'd been having dreams about her for 6 months. I knew her name was like the name of a flower. And I remember we'd only been married 4 months, and I just saw her and I knew. And when they said her name, and I said, God, why would you show me this child now? Like, I've got to go and work in the US for 15 years and save all this money. And, you know, then we fund the hospital. Like, why are you showing me this child who I know I'm supposed to have in a country that adoption's completely closed? Like, what is going on? And as I was like praying that prayer on the way back from the orphanage, we drove past this building, and 4 years prior, I had drawn that building. So I had him slam the brakes and like, stop, like, I need to see this building. And we get up to the gate, and there's a phone number taped to the gate. And I was like, that's weird. So I just called it, and it was an apartment complex they were building, and they were pre-renting everything. And the guy's like, this is not for sale. Like, this is my first investment, blah, blah, blah. I was like, okay, well, I'm flying out of Nairobi tomorrow. Like, can I see you here in Migori before I leave? And he was like, actually, I live in Nairobi. I was like, okay, I'll meet you like before I go to the airport. And I had, you know, kind of crunched numbers with him. What would it take to get this building? And he finally got to a number that he was like, only this would I sell the building. I was like, okay, well, I'll be honest, I have no money in my pocket. I only have credit card debt, and I don't know how this is going to happen, but I just know God's going to do it. And he's like, okay, forget you, girl, you wasted my day. And kind of rightly so, but went home, wrote 1,000 letters, had no responses. And then, you know, price went up, all these things. And then one random donor 6 months in finally just came in and said, hey, I want to fund this project. And it was a bit of a business deal that I happened to be the beneficiary of. It wasn't even something completely charitable, something between one of my relatives and someone who wanted to buy the building. And so very bizarre. We went from having absolutely nothing to having a hospital building overnight. And that was the first of a series of miracles that has kept this entire thing afloat and growing.
Yeah, I mean, it's just it's crazy, but it's just, you see, I mean, like, it's that difference of feeling what could have been closed doors for you in medical school to then, like, hey, here's some wide open doors, just start walking through.
Yeah.
And so you guys walked through, and so obviously the building was not set up as a hospital. I know it took some time to kind of get some things set up and in place, but kind of as you started bringing kids in, I mean, what was the process of kind of going and potentially finding patients? Like, who are you kind of connecting with and appealing to in those early, kind of first early years?
Yeah, in the very, very beginning, I was actually like manually going out to orphanages, going out to communities, kind of getting anonymous tips and finding children just in all kinds of places. And we eventually figure it out a more sustainable system. But I think that time was also really important because I do understand the conditions that these kids are coming from, and it gives you a completely different compassion and empathy. And as a clinician, it's so important. It's not just discharging children and they go back to healthy homes. Like, they could die in 2-3 days, even in perfect health, if you don't change something about the home. And so we still work really closely with the orphanages, but we also really work to build sustainable systems that keep the kids from going into orphanages, institutions, all of that in the first place, because it is a bit of an endangering situation. It really, really is.
Yeah. Yeah. I mean, when you talk about, cause I mean, this is one of the programs that when you shared this with me, I mean, it was just super fascinating to me, but of kind of trying to get ahead. I mean, we talk about this sometimes in the United States in the sense of foster care, that like, you know, you kind of, if the foster adoption system is kind of a river, right? You can kind of walk up and see kids floating down the stream and you're kind of pulling them out. But at some point, right, somebody has to recognize, like, why are kids falling in the first place?
Yeah.
Right. And how do we go upstream and do something about it in some way? And so I think you guys have very creatively done that through the hospital. And so you talk about that program and just kind of what that does. I think it's so amazing.
Yeah. Yeah. So we do something called the Infant Protection Program. So what I found was that a lot of times orphans are not actually orphans. And I think everyone's aware of that now, that a lot of times people are putting their kids in because one of the parents has died or because of financial circumstances. But the problem, the corruption that a lot of people don't know about is once children go into these institutions, it's not very reversible. In a perfect world, we would think that, you know, a child would just get adopted, or that if the parents stabilize, that they would just go back into the homes. But once they get into these programs, they really become, a lot of times, sadly, income producing materials. And so even if a child is sponsored for $14 a month, that seems like a really good thing, but sometimes that's putting a child into bondage in an institution, because that is a sponsored child and that's a promise of income for that institution. It becomes a tourist destination. People will charge a lot of money for people to come and play with the orphans. And while on these trips, a lot of people will become attached to one orphan and they keep asking about it. They sponsor a certain amount and that becomes like their child. And that child, they will never let them leave the orphanage because there's an American that loves that child. And so I was just devastated and didn't want to even have that own temptation myself, because I am someone who depends on donations right now to run my hospitals. And so, you know, if a child gets sponsored $10,000 a month by someone who dreams of adopting them or who just wants that to be their child, like, I don't even want to have to blink an eye, because I've seen so many other great organizations fall into that, and it just keeps children out of families. I think I told you specifically, I knew of one little boy who had HIV, who had been abandoned, and how stigmatized that is in our culture, and the fact that someone wanted to adopt him. Very much a local family. Kenya's completely closed adoption to anyone other than locals. And so the fact that someone wanted him and he was turned away because of a $14 a month donation, that broke my heart. And I said, I don't care how little or, you know, how much this affects our finances, we have to start doing this a better way. And so we did away with child sponsorship, and we started doing impact investing, where people could come in and support the children as a whole. And we really try to celebrate when they go home, when they're reunited with their families. And the Infant Protection Program was born out of, how do we keep the children from getting to orphanages in the first place? Why are they going to the orphanages? And what we found is it's a high rate of maternal death. So in our culture, when the mother dies, the father is just expected to take the child to the orphanage because there's no breast milk. Some of them will really try to get them water with sugar and salt. The child starts to die. They lose hope. They're like, if I stay home and take care of this child, I can't even feed my other 7 children because I'm a farmer. I'll lose my job or my crops will die. Like, to save the lives of my other children, I have to take this child to the orphanage. They drop them off at the orphanage or call the police to come and take them to the orphanage. They never see their child again. They even repress them in their mind. And what we found is if we could be that resource for that father, if we could be that place, we would nourish the child, protect the child, give them their vaccination, give them critical medical care, give them loving caregivers, encourage them to come and bond with their children over a period of even up to 2 years, if that's what's needed. Some of them, they're ready to take their kids home after 6 months, and it's such a beautiful thing to me. Like, you just see the smile on the father's faces. Like, they didn't even know that they wanted that child so badly, but that's their flesh and blood. And they're always just so grateful and so proud of their child. And, we do keep the kids coming for follow-ups, and just seeing that relationship sustained. There's nothing like it. I do have an adopted child, and I know how good it feels, to have one less orphan in the world that way too. But we're never going to run out of orphans. I hope one day we do, but, because of tragedy, it always happens. So we have to, by preventing children from becoming orphans, the children who have no other option will be more likely to be adopted, to find homes. And so I don't know, I'm so passionate, so passionate about solution focused systems. I told you that when we talked on our own too. Yes. It's easy to get caught up in the data and the statistics. We saved this many lives. We touched this many orphans. Well, how do we prevent them from becoming an orphan in the first place? How do we keep them from getting sick again? How can I build a hospital system that can't even be called an orphan hospital because there's so few orphans in this country? So yeah.
I mean, I think it's amazing. I'm gonna real quick, because I just think, again, I think a picture is just so beautiful. I've got one. So we were talking earlier, and Amy's calling from her phone, so pulling up a picture is kind of hard to do. So I actually have one. So I'm going to screen share real quick. Hopefully y'all can see this on Facebook. But I know this is one of those stories, right? This dad getting reunited with this little girl. And this is just perfect. Like, this is, again, like, you can see the love and affection here, right? And I know that took a lot of time and a lot of energy and a lot of people getting involved in that, but how beautiful to see the full, of that story, right? To see that like come to fruition. So, I love that reality that you guys really are trying to like think creatively about not just keeping this thing going, but how do we do something to kind of intervene, and knowing that, like you said, we're not running out. Like, it's not that we're saving every one of them, or that we're able to kind of intervene with every kid, but man, that one family right there, that's pretty incredible to see their story changed in that really powerful way. That's so awesome. So
thank you so much.
Tell us, like, do you have, I know that you get, very attached to almost every kid that comes through your facility and comes through your programs, but can you tell us just one or two stories of just, hey, a kid that's kind of come in that you just seen just the amazing transition and transformation of their life through the ability of what's been able to happen there?
Yeah, of course. Goodness, there's so many. I just remember one of our very first patients was Jecania, and he is just the most intelligent, creative child. He has no function in his limbs whatsoever. He can move with the core of his body, but he was dragging himself up and down the road on his bottom, actually just using his foot to point to trees and just begging people to climb them and go get a mango so that he could eat. And he would just, he eventually got taken into this rescue center, but none of the schools would let him go to the school because of his condition. And every day when the kids would leave to go to school, he would just sit and cry. He was 10 years old. He just so badly wanted to go to school. And we got to bring him in, and he had a surgery, and it was even a failed surgery. He had arthrogryposis, which is basically being born without joints, and just tried to get some contractures out to where he could sit in a wheelchair. And even though it sounds funny that I would pick this as a success story, because, it started out really horrible. Like, the surgery wasn't effective, he didn't get that immediate miracle, but the child taught himself how to stand. I've never even seen it happen in the US.
Wow.
He is getting ready to go to school now. He builds, he like taught himself to play piano with his toes. He builds and paints masterpieces with his mouth. Like, he lost the ability to write with his feet after the surgery. And so he learned how to write with his mouth. And brilliant drawings, and his dream is to actually become an eye doctor with a 6-story eye hospital, which just makes me laugh so hard because we have a 5-story hospital. So I felt like he was like outdoing us one, but I mean, just the way to see him, I just literally walked in one day and he was standing. It never should have happened. But just to see the miracle in his life, he's never complained once. He doesn't want anyone to feed him. He is just the most independent, innovative, and confident child. And to get to foster that and to actually put him on a path to where his dreams can come true and to where he's not begging on the streets, he's getting an education and changing our world. How brilliant that he wants to be an eye doctor. You know, he can do that. He can do that. And so, yeah, his story is touching to me. And then we have other stories like I had a child named Sally who I got to his house and I was like, how old is he? And they said 4. And I was like, 4 months. And they're like, no, 4.5 years. And I picked him up. He was not even 12 pounds. He was tiny. He looked like a little baby and just had this like burnt corn cob in his hand, just clenching it. He couldn't speak. And he had a twin sister who looked about 2. She was a little better condition, but not, they both were nonverbal and just had been completely abandoned by their mother. And I remember just not even wanting to finish the exam because I was so distraught by what I was seeing. I just wanted to get in the car. I didn't think the child was going to live another day. And we got him home and started nourishing him. And now if you see his picture, he's just the most plump and little thing, and he's running around everywhere and learning to speak, and his sister speaks fluently, is even starting to look more our age. And I mean, I just honestly didn't even know that a child could go from that being that close to death to just having life. And actually my role has changed a lot now. I don't get to go and personally get the kids as much. You know, we've hired a team of 60 medical workers and they go and they do. And, you know, we have 3 more hospitals coming up in Bangladesh, potentially 1 in a rural area, a cancer center coming up in Puerto Rico. And so, you know, I'm tied everywhere, but it's been so beautiful to get to have had that experience. And that is my dream life, but I'm getting to give that to thousands of other vulnerable people all around the world who are just as qualified and more qualified than I am. And it really taught me, and I hope because I know my story can come off as, you know, a little bit Mother Teresa and blah, 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 but really what I am doing could be done by anyone who's watching this at home, just advocating, dreaming, praying, letting people know the needs and enabling the local people to do it themselves. So that's where my journey started, going out and experiencing it. But now what gets me up every single day, talking about it, sharing about it, promoting it, studying the business side, the marketing side, all these things, is just knowing that life-changing experience, like getting to save the life of that child, but also allowing someone to be that, the empowerment they get from that experience, like getting to give that to people for what we hope to be 888 hospitals all over the world. Just think of the thousands and thousands of people who get to be empowered by saving those children's lives. That's the best thing of all, is like getting to change not just the lives of the children, but the people who are getting to impact them. Like, to me, there's no better gift than getting to serve and getting to do the work.
Yeah, that's so cool. Yeah, I mean, that's something we hadn't really even, I mean, again, there's so much great stuff to what OVI is doing, but I mean, that's another beautiful piece that, like, you and Robert are the only Americans on staff right there in Kenya. And so it's mostly a fully Kenyan staff of Kenyan doctors and nurses and the caregivers. You know, you're able to bring in people. I love, you know, that you're bringing in folks from the community to be caregivers, to participate. I love, I mean, one of my personal favorites is some of the guys that you have on staff as caregivers that are, you know, because you know, don't have an elevator, they're carrying kids up and down stairs and being a part. I mean, that's just incredible. Like, and I mean, some of the pictures that you've shared of just the smiles of these guys just carrying the kids up and down the stairs is just powerful to me, even. That, hey, this is a role that they're playing, that they feel this empowerment in their experience, which is just amazing. So you mentioned it, but I do want to just give you the opportunity to say, like, you know, what's next? So you've got this one location in Kenya, and now it's looking to the possibility of even other countries, which is really incredible.
Yeah. Yeah, absolutely. So we've been entrusted with 2 new buildings in Bangladesh, and then our, like I said, kind of exploring a potential opportunity in Puerto Rico in an island called Vieques, because they have a very high cancer rate. So that's new. That's very new. We haven't agreed to that officially yet, but are exploring that. But yeah, God is just opening so many doors. And my passion is modularizing the system to where these are hospitals that are enabling and empowering vulnerable communities to come out of poverty, like to end the poverty cycle, to end the orphan crisis, and to stop human suffering as much as possible. So yeah, that's my role, is to just keep on advocating and building systems that work, hospitals that aren't just healing children and discharging them home, but actually doing the work of the emotional help, restoring the families, making sure that people know how to dream, people know how to pray and have faith that, you know, they don't have to grow up and just do one little small task, like they can change the world too. And that's where it goes so much deeper than healthcare. Is just every single thing we do is so intricate and so intentional. And that's what I want to bring. That's what I want to bring to the world. A lot of what I do too, it's funny, because I laugh because everyone already thinks that the 888 hospitals is enough. But another thing I do on the side is teach other people how to get conscious brands and humanitarian efforts off ground in a sustainable way too. So I'm building these systems, but I'm also showing other people who have dreams of building orphanages or building schools or whatever it is, how they can go in and utilize similar models to do that. So I believe, you know, there's so much that we can do with our 2 hands, but even more with our mouth. You know, just, you never know, like that one person, if you just think of that one person who said, if that's the life you want to be living, then why aren't you living it? None of us knew who that is. I don't remember his face. I couldn't get him in a lineup, but he changed my life. And because of him, because of that sentence, you know, now everything that I'm doing, all the hospitals that I'm developing, and then all the people that I'm empowering to go and change the world too, that came from one sentence. And so just knowing that we all have that power inside of us, and that we can really, I mean, God-sized goals. We just have to believe that we're capable of it. And so, yeah, that's my passion. That's what I see for the future, is just always making time to inspire people to believe in their own God-given callings, because he is the only qualification I have is him. And the reason that I know that I can do absolutely anything that he asked me to is because of his ability to work through me. And so I think that's the most exciting part of everything, is like, we all have that same God and we can all access that. And so I don't have to give you any crazy life tips. I can give you the technicalities of how to do something, but the fact that God can step in and do anything through anyone is really exciting to me. And so that's why, you know, I love powering my organization, but I love just getting on calls like this, because it only takes one person hearing something to do something a millionfold of what I'm doing. And that encourages me.
That's so cool. That's so cool. Well, for folks that are watching this, whether right now or after the fact, how can they know more about what OVI is doing, and how can they kind of be involved to help and support your all's efforts? What are some things they can do to do that?
Yeah, absolutely. So we are, of course, on social media, like everyone else in the world. We have a Facebook and an Instagram. We're going to start doing Zoom calls in September, I think on the 22nd, when I get back and I get established again. They're going to be very topic focused, but also kind of Q&A. So if you get attached to our vision, there's something we have called the Global Advocates Program. It's very versatile. Some people get in just to have like a few extra emails and access to the Zoom calls and things, but you can even invite people on to those calls every single Tuesday at 8 p.m. Eastern time, starting in September. So you're like, hey, you know, I heard this girl who I think you'd resonate with. You don't have to even set up a meeting with me. It's every single Tuesday. You're going to be able to send people to those Zoom calls. Our Instagram, our social media, our website is just OVI Healthcare, ovihealthcare.org. But yeah, we're showing up however we can. It's busy. It's really, really busy. If we don't get an email back out, it's because I am the US side of this organization right now. That's just how it is. But, you know, we do try to keep people updated through social media, through the Zoom calls. And if someone has a unique ability, and they feel like we always have a place. There's always a place. We love to collaborate and to delegate things. So much of our organization, if you look at our numbers and you look at what we've done, it's absolutely bizarre, but God just sends people in who have stepped up, helped us with even our books or our social media or editing YouTube videos. It's all kinds of ways that people get involved that aren't even monetary, that have just been worth millions and millions and millions to us and to furthering our organization. So
yeah, I remember even just this is such a small thing, but like when we first started engaging and you shared some financials with us before we kind of contributed from the church side, which is something we do with most organizations. I shared that with one of our kind of auditors, and he was like, I'm not really sure how they're doing what they're doing with the amount of funds. And so I think that's incredible, what you guys have been able to do with what you have. And so
we're very frugal. I can thank my small town country parents for that. We're frugal, and God is really there's times where we're like, how are we going to do this? And someone just falls out of the sky and is like, hey, we would love to do CFO outsourcing for free, or we would love to do. And it's like, God has been really gracious in that way.
Well, I encourage you guys, if you're listening, again, I hope this story tonight has been inspiring to you. Not only kind of what Amy and Robert have done to get this organization off the ground, which is just doing some incredible work, but those stories that you've heard. And so if you are interested, we'll put a link to OVI on this post in the comments, and I encourage you guys to check it out. Check out what they do. We love what they're doing and want to continue to support them as a church. And we can't be everywhere around the world, but we're part of a global church that is doing so many amazing, incredible things. We're part of one big body, and you guys are a part of that. So thanks so much for being here tonight. Thanks for joining us. Check out OVI, and we hope that you enjoyed listening in on this conversation. Thanks, Amy.
Yeah, thank you so much.